Hi, my name is Justin Wilson. I'm the Senior Director of Communications here at the Institute for Justice. And this afternoon, we've released a pretty major report on how state laws limit healthcare access. We got started looking at this at the beginning of the COVID pandemic as states across the country were talking about the limited number of ICU beds that were available for individuals who needed them. And having dealt with these kinds of laws in the past, we recognized that state laws limiting the availability of hospital beds and other medical services, they're called CON laws or certificate of need laws, were playing a pretty major role in limiting the number of hospital beds available to individuals. So our attorneys set to work researching these laws. They actually filed 2 lawsuits challenging them in the middle of the pandemic. And now we've got this report. So I'm joined by my colleague, Jamie Kavanaugh, who is the lead author of the report. Jamie, you have been up to your elbows in researching what's going on with these CON laws. And can you tell me sort of what you've learned after doing that research?
CON programs deny flexibility to healthcare providers and harm patients. So in order to allow healthcare facilities to respond appropriately to the pandemic, states quickly had to suspend their CON programs.
So we've been working on trying to get rid of these laws. And just so everyone's listening understands, these are laws that require a hospital. Let's say a hospital wants to add 5 more beds because they think we need 5 more beds. In a lot of states, they can't add those beds without going through this long bureaucratic process. And they could be told, no, the government doesn't think you need those beds, right? I mean, can you explain sort of how that works, Jamie?
That's exactly right. In 32 states, hospitals have to ask permission from the government and prove need before adding hospital beds. And then their competitors can come in and actually argue that there is no need for those additional beds and can tell the government, don't issue this certificate of need. That's just simply not how the healthcare market should be operating.
And as we were looking at this and talking about it, what became pretty clear is that there would be a lot more ICU beds in America today if these states hadn't been clinging to their CON laws. And I say clinging because these laws are from long ago. They are 30 or 40 years old. And a lot of states have started to get rid of them, but others are clinging to them. Kind of explain sort of the dynamic and how this patchwork has created this problem.
You're right. There's a dozen states have successfully repealed their certificate of need laws. And 40% of the nation's population live in states without certificate of need laws. And there are no harms there of living without a certificate of need law. But the states that maintain their certificate of need laws do so at the bidding of powerful lobbying organizations. Hospitals claim that they will go out of business without these laws, but that's simply not true because we see states like California, Texas, Pennsylvania, they all have successful healthcare markets and thriving hospitals without certificate of need laws on the books.
Yeah, it seemed really complicated. So we were hearing hospital administrators sort of, getting really frustrated that there weren't ICU beds available and that we were going to have a shortage and everyone was getting very worried. And then here we were sitting at the Institute for Justice having worked on this for so long saying, but wait a minute, it's the hospital lobby has been by and large responsible for the limited number of beds.
That's exactly right. For instance, in one of Institute for Justice's cases, we're challenging the certificate of need laws in Kentucky right now, and the Kentucky Hospital Association intervened in the lawsuit to defend the certificate of need laws. This shows again that it's the hospitals who care about these laws. It's not patients. Patients don't benefit from these laws. Patients aren't the ones intervening in the lawsuits or intervening in the CON application process to say, we really need to limit the availability of healthcare services and facilities.
It's if you ask anyone on the street and you say, like, do you think that we should have limits on how many beds a hospital can add or services? I think anyone would say, like, well, no, right? I mean, if they want to make the investment, if those beds are not full and they can't sustain them, then I guess they would get rid of them, right? I mean, like, that's the market forces, and this seems like a pretty simple market to understand.
That's right. And it's been difficult. Sometimes it's difficult to explain the problems with certificate of need laws, but the problems were exposed, unfortunately, during the pandemic. And that's why so many states had to quickly respond and waive or suspend their laws. And now we're asking those states to permanently make those suspensions permanent and get rid of their certificate of need laws.
So we've got this report, and the report lays out just how convoluted these laws are. In fact, I was looking through it and they are filled with exceptions. And from our experience, and you've got more than I have, every little industry is trying to fight for their one little teeny carve out so they can do their one thing. And by and large, what becomes clear is that there shouldn't be a law that is in place that creates a huge problem for healthcare access that is then also riddled like Swiss cheese with exceptions.
Yes, that was one thing we wanted to point out with the report. We list all the con requirements for every state that has a con law, but then we also list all the con exceptions. Now, if a program has, say, 30 con requirements, but then 50 con exceptions, you might wonder, what function is this law even serving in the first place?
Right. It's basically the only people left regulated are those who don't have the political prowess to have gotten their own little carve out.
That's exactly right, Justin.
So tell me a little bit about how the notion of need, and I'm going to use scare quotes here because we think it's pretty ridiculous, how need is calculated in a lot of these circumstances and just how that works.
So sometimes the state offers up its own formula where it determines need, and then if the state on its own says there's a need for a specific service like ICU beds or primary care physicians, if the state determines on its own that there's a need, then new providers can come in and apply for a certificate of need and open a business. Other times, the new providers have to hire experts on their own and try and prove to the state that there's some need for this service, but no one should have to prove to the government that there's a need for their service. All businesses go out and do their own research before opening a business they want to know that they're going to be a viable business.
Right. It's like if you want to open a restaurant, that's the risk that you get to take. Is this a location where people want Mexican food? Well, I'm going to find out by opening the restaurant. But in the con case, a medical entrepreneur or a hospital that wants to add beds or someone else is told, you don't even get to try, right? The government knows what's needed. We don't think anything is needed. You're not allowed to even give it a shot.
Yeah, and the bigger problem is often that almost all con programs have a built-in competitor's veto. So the existing incumbents get to come in when a new provider applies for a certificate of need, and the incumbents say, we'll take care of any need that arises, we'll expand, and they tell the government, do not issue a new certificate of need that will harm the existing businesses. But really, it's just a government-backed shield from new competition.
So last week, we got some really good news on Friday, and we had filed a lawsuit and actually had a pretty scathing opinion from a judge. Can you give me a little sense of the progress that we're making on the legal side?
Yeah, so we got a great opinion from a judge out of Kentucky last week saying that certificate of need programs harm patients and all they serve to do is protect existing hospitals from competition. This was just an initial step. We survived a motion to dismiss, so the case will continue, but we're very excited. The opinion is full of great language about how anti-competitive certificate of need laws are.
So let's talk about where we're going from here. We've got this report that lays out this patchwork of laws riddled with exceptions. We have sent letters to almost every state that has con laws that we did in the middle of the pandemic, basically demanding that they drop their requirements. And we've got lawsuits pending in 3 states. Where do you see the debate about cons going at this point?
Well, lawmakers clearly are paying attention to certificate of need laws right now. So whether we are getting rid of con laws through our 3 pending lawsuits or whether we're working with lawmakers to reduce or repeal con laws in their entirety, we're happy to keep fighting to reduce the burdens that con laws are placing on healthcare providers and on patients.
It seems that the bottom line for all of this is that we've been working on this issue for years, and it should not have taken a pandemic to illustrate the fact that there should never have been a limit on the number of ICU beds or normal hospital beds or outpatient surgery facilities or any of these things. And, it took a pandemic to do this. And now we have a lot of governors who have stayed their laws, right? Put them on pause. And now we just have to hope that they recognize that the sky didn't fall when they put them on pause. The hospitals didn't go out of business. And either they can do it of their own fruition, or IJ is a public interest law firm, and that's what we do, right?
Exactly. We'll continue looking for opportunities to file lawsuits, but we're hoping that the atmosphere is changing and maybe we can work with legislators this session and in the coming sessions to repeal the laws like 12 other states have done.